I guess it all started on August 9th, 2024, when we lost our firstborn son, Nicholas.
Vanessa's diagnosis was spontaneous labor due to cervical incompetency.
He was with us for about 2 hours until he passed. When we found out that I was expecting again, at that point, we were going to do everything possible to reach full term.
That was when the Ruffinos turned to Trinity Health of New England and the maternal fetal medicine group at St. Francis Hospital.
So Dr. Pimentel, she really took her time to explain what the cervical cerclage was going to do. We felt heard and validated. I felt safe with her, and I knew that she was going to be able to do everything possible to keep the pregnancy going.
Having to go through a loss to, then be taken seriously was just, well, it was unbearable at times. So when we found out she was pregnant again, being able to meet a different team, with a different level of care, it took a certain burden off of our shoulders. We were able to breathe, be at ease.
I love all the diaper changes, all the cries.
Baby Victor was born in St. Francis Hospital on June 11th, a healthy 6 pounds, 11 ounces.
It's been wonderful to see him and have this baby in our arms.
In one day after giving birth. I'm Dr. Carrie Ann Silverman. I am the Regional Chair of the Women and Infant Service Line for Trinity Health of New England.
Of Trinity Health of New England's 5 hospitals, 4 offer women's services and 3 provide labor and delivery services.
St. Francis provides services along the entire spectrum of obstetric care. We have a level 3 nursery, and we deliver the most premature babies and take care of the highest risk moms. Our colleagues at St. Mary's also have a NICU and take care of high risk moms. And then our services in Mercy are more for low risk moms and full term babies.
Hello, it's Dr. Magadina. We're here to deliver your baby. I'm Irina Magadina. I'm a physician here at St. Mary's Hospital. I'm the chair of obstetrics and gynecology. Women will always need maternal care. And it's important for us to deliver that care so that women's needs don't go unmet. We're a small community hospital, but the care that we provide is equal to large academic centers in every way.
We provide critical services to at-risk moms regionally during their pregnancies, from early on doing genetic counseling for various familial diseases, giving patients difficult news regarding inherited abnormalities for babies, and then taking care of moms with a lot of very common obstetric conditions that occur during pregnancy. For example, gestational diabetes. Most women entering into a pregnancy have never heard the term cervical insufficiency before. They have no idea what that is. And unfortunately, many of those moms have a occurrence that's quite traumatic, not having any awareness or knowledge about it at all. So certainly educating them that it's not their fault, that they didn't do anything wrong, because that can be a big turnoff to seeking care early in the future.
We want to be able to offer our patients the most technologically advanced care. We want to keep up with patients' needs, and as patients' needs become more individualized, more complex, we need to maintain the higher standards of care.
Advances in technology includes a focus on institutional safety.
The security system that the Gala funds provides a really great upgrade for all of our birthing hospitals in terms of our neonatal security.
It's one of the first things that goes on their babies, and patients want to feel safe. We are a closed unit here on labor and delivery, so it gives patients a sense of peace of mind.
I was able to experience that full pregnancy joy as well, and of course have this baby in my arms and love him and kiss him.
Without these technologies, without these investments, I think there'd be a lot more heartbreak in the world. We get to share this joy.